COVID spread across the world and changed daily life. Ebola became one of the most feared viruses in modern history, and hantavirus can turn from flu-like symptoms into life-threatening breathing failure. But which one is actually more dangerous? The answer depends on what you mean by dangerous. Are we talking about how easily it spreads, how often it kills, or how fast it can overwhelm the body? This video compares hantavirus, COVID, and Ebola using verified medical facts, not panic. We'll compare how these viruses spread, how deadly they can be, what they do inside the body, and why one virus can be globally disruptive while another can be rare but medically terrifying. This is for educational purposes only and is not medical advice. If you have health concerns, consult a qualified healthcare professional. When people ask which virus is more dangerous, they usually want one simple answer. But in infectious disease, danger has multiple meanings. A virus can be dangerous because it spreads easily. A virus can be dangerous because it kills a high percentage of infected people. Or a virus can be dangerous because it causes rapid, severe illness in a small number of cases. COVID, Ebola, and hantavirus are dangerous in very different ways. COVID changed the world because it spread efficiently between people. Ebola terrifies doctors because outbreaks can have extremely high fatality rates. Hantavirus is frightening because severe cases can progress quickly into respiratory failure. But these viruses are not equal in transmission, outbreak pattern, or public risk. So the right question is not just which one is deadliest. The better question is, dangerous in what way? Let's start with transmission because this is where the biggest difference appears. COVID spreads mainly through respiratory particles from infected people, especially in close indoor or poorly ventilated spaces. That is why COVID was able to move quickly through households, workplaces, schools, airports, and crowded events. Ebola spreads differently. It is not usually spread through casual airborne exposure. Instead, Ebola spreads through direct contact with blood, body fluids, or contaminated materials from someone who is sick or has died from the disease. That makes Ebola extremely serious, but harder to spread casually than COVID. Hantavirus is different again. Most hantavirus infections happen after people inhale particles from infected rodent urine, droppings, or saliva. This often happens in dusty, enclosed spaces, such as cabins, sheds, barns, storage areas, or buildings with rodent contamination. Most hantavirus strains do not spread from person to person. The Andes strain is the major exception because rare human-to-human spread has been documented, usually through close contact. So in terms of easy human spread, COVID is clearly the strongest. Ebola requires direct fluid exposure, and hantavirus usually requires environmental rodent exposure. Now let's compare severity and fatality. This is where Ebola becomes one of the most dangerous viruses known to medicine. According to the WHO, the average Ebola case fatality rate is around 50%, and past outbreaks have ranged from about 25% to 90%. That means Ebola is far more lethal per diagnosed case than COVID in most settings. Hantavirus Pulmonary Syndrome is also severe. According to the CDC, around 38% of people who develop respiratory symptoms from HPS may die from the disease. That is extremely high compared to many respiratory infections. COVID is different. Most people infected with COVID develop mild to moderate illness and recover without hospitalization. But because COVID spreads so efficiently, even a lower fatality risk can still lead to huge numbers of hospitalizations and deaths when millions of people are infected. So if we ask which virus is deadliest per severe diagnosed case, Ebola is usually higher. If we ask which virus caused the largest global disruption, COVID is clearly the answer. If we ask which rare virus can become deadly very quickly, hantavirus deserves serious attention. Each virus attacks the body differently. COVID is primarily known as a respiratory virus, but it can affect more than the lungs. It can trigger inflammation, blood clotting problems, and long-term symptoms in some people. Ebola is a hemorrhagic fever virus. It can cause severe fever, vomiting, diarrhea, weakness, organ damage, and in some cases, internal and external bleeding. Death often comes from shock, organ failure, and severe fluid loss. Hantavirus Pulmonary Syndrome works in a different way. It can begin with flu-like symptoms, such as fever, muscle aches, fatigue, headache, nausea, or abdominal pain, but in severe cases, the disease moves into a dangerous cardiopulmonary phase, blood vessels become leaky, fluid builds up in the lungs, breathing becomes difficult, oxygen levels can fall quickly. The CDC notes that without adequate treatment, many deaths in HPS occur within 24 to 48 hours after the cardiopulmonary phase begins. That speed is what makes severe hantavirus cases so medically alarming. It is rare, but when it becomes severe, the window for treatment can become very small. Now let's compare pandemic potential. COVID had the strongest pandemic potential because it could spread efficiently from person to person, including from people with mild symptoms or before symptoms became obvious. That made containment extremely difficult. Ebola has caused major outbreaks, but it is usually easier to identify and isolate once people become very sick because transmission is closely tied to direct contact with body fluids. Hantavirus has much lower pandemic potential because most strains do not spread between humans. The main risk is exposure to infected rodents or contaminated environments. Andes virus is the important exception, but even there, human-to-human spread is considered limited and usually requires close contact. This is why health officials can treat a hantavirus outbreak as serious without calling it the next pandemic. Low pandemic potential does not mean harmless. It means the virus does not have the same easy transmission pattern that made COVID globally explosive. So which virus should people fear most? The honest answer is that fear is not the best tool. Understanding is. COVID is dangerous because of scale. It spreads efficiently and can cause severe illness, especially in higher risk groups. Ebola is dangerous because of severity. It kills a high percentage of people in many outbreaks and requires rapid isolation, treatment, and infection control. Hantavirus is dangerous because of exposure and speed. It is rare, but severe cases can progress quickly and may require intensive medical care. For the average person in the United States or Western Europe, hantavirus is not an everyday threat. Ebola is also not a common daily risk. COVID remains more familiar because it spreads far more easily between people. But if someone has rodent exposure and later develops severe flu-like or breathing symptoms, hantavirus is not something to dismiss. The real lesson is that every virus has a different risk profile. The smartest response is not panic. It is knowing how each one spreads and what warning signs matter. Key takeaways. COVID spreads the easiest between people. Ebola has the highest case fatality rates in many outbreaks. Hantavirus is rare, but severe cases can become life-threatening very quickly. The most dangerous virus depends on the question. Spread, severity, and public risk are not the same thing. If you found this helpful, hit subscribe and the bell icon for daily hantavirus coverage and public health updates based on verified science. Comment below which comparison should come next. Hantavirus versus Lassa fever, hantavirus versus flu, or a full breakdown of which U.S. states have the highest hantavirus risk. Your questions drive the content.